We will talk about cystic fibrosis or mucoviscidosis. They are same disease, and it's a rare genetic disorder, but very important because it directly affects children's lifespan and person's lifespan. And most important characteristic of this disease is respiratory symptoms like frequent lung infections and digestive symptoms like diarrhea. And what's happening on this disease? We have genetic mutation which is called CFTR mutation, and this mutation causes defective production of protein which name is same, CFTR protein. And when we have defective protein, it causes defective transport of chloride ion, and it causes increased chloride ion into mucus, and increased chloride ion causes thick mucus and sticky mucus. It traps bacteria, and bacteria multiplication of these bacteria causes clogged respiratory airways. It causes lung infections, bronchitis, and we have frequent respiratory infections, and difficult to cough up this plugged and clogged mucus. Usually this disease occurs before the age of 2 and lasts whole life. We have no cure, so this disease affects person's lifespan, and symptoms usually worse over time. During infancy, we have bowel obstruction with meconium and difficulty gaining weight. Even with a regular diet, it's important problem, and first suspect can be taken here because when there is obstruction and difficulty gaining weight. Also, classical symptoms are respiratory infections, coughing, wheezing, frequent lung infections which requires high dosage of antibiotics, and decreased lung functions in adulthood already, and ongoing digestive problems, usually diarrhea. And classical symptom also is when you kiss kids' cheek, you feel more salty skin. And why it's so salty? Because chloride ion in the sweat, increased chloride ion also causes increased sodium level, and we feel salty taste on kids' skin. What is diagnosis? Diagnosis is high chloride level in the sweat. That's gold standard of diagnosis, usually more than 60 millimole per liter, and elevated immunoreactive trypsinogen in the blood. It's screening test for infants. Also, genetic testing is available, but it's more expensive and done much rarer because we have gold standard of diagnosis. It's elevated chloride level, and treatment is airway clearance techniques, antibiotics, usually high dosage to treat these lung infections, and CFTR modulators. They are effective. They improve lung functions around 50%, and it's high effectivity actually. Pancreatic enzyme supplementation is important to cure digestion problems, and mucolytic to thin mucus and ease cough up this mucus. And prognosis is 50% of such people will reach more than 40 years old, and unfortunately 50% will die before 40 years old. Of course, it's a better prognosis what was before modern medicine, because most kids were dying before. Historically, most kids were died in childhood with cystic fibrosis, but nowadays, because of antibiotics, because of mucolytics and CFTR modulators, we have much longer lifespan, which is optimistic, of course. There is several studies about CRISP gene technology and gene modulations also, but not clear results yet. But there is new hopes, and in time I hope there will be very optimistic results. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.